right, March is Colorectal Cancer Awareness Month. Very treatable cancer with a high survival rate. So we're joined right now by Dr. Michael Blume, Gastroenterologist at MedStar Good Samaritan Hospital. Doctor, thank you so much.
Thank you.
All right, so we've got questions. We're taking calls next door in the studio. So what's the most common reason why people postpone? I won't tell you mine, but people postponing those colorectal screenings.
There are three major ones. The first is nobody likes to talk about this, and it's a little embarrassing. And one of the good things that we're doing when we're discussing something like this is we're getting the topic out of the bathroom. It's really important not to be afraid or embarrassed to talk about bowel function or colonoscopies. So that's the most important thing. The second misconception is the idea that if you don't have symptoms or you don't have any family history or you don't have any bleeding that you're okay, and that's just not correct. You still need to be screened. And the third issue is the fear about this being painful. I mean, the bowel preparation everybody hears about, and it's a little inconvenient, but the test really, it's just not that bad, and it really doesn't hurt, and you really shouldn't be afraid to do it.
So what kind of questions should you ask your doctor before you have this as you're preparing for this?
Well, the first thing is that if you have any specific symptoms or problems that you need addressing, let him or her know about that before the test, preferably not the day of the test, but the day before or shortly before then. Remember, a colonoscopy is a test. The purpose of a test is to answer a specific question. So it's very important when I'm doing an exam that I know what I'm looking for, what questions I need to answer, or what problems I'm trying to solve. The second is make sure that they're aware of what medicines you're taking. This is especially true for blood thinners, diabetic medications, blood pressure medications, because it's important that we know about that. We may need to adjust your medicine so this can be done safely. And the third is make sure they know about really what other medical problems that you have, because that's important for us to do this safely too.
So you start at 50. When do you stop screening people for colon cancer?
That's the $64,000 question. And we always think about age to some degree, and that's important because remember, when you do any test, you look at what we call benefits, risks, and you kind of weigh those two things. So as we age, the benefits may go down a little bit, the risks may go up a little bit, but age is a number. We always think about 75 or 80 where you start to think about that, and in my eye, that requires a conversation about whether this makes sense, but it's not really how old you are, it's really what kind of shape you're in, what's your general health, and does this make sense? So somebody who might be 70 years old but has multiple medical problems, you know, maybe doing a screening colonoscopy isn't a really great idea. On the other hand, if you're 75 or 80 and you're really healthy, well, maybe that makes sense. So you really have to look at the entire picture about what's going on here.
All right, Dr. Blume, one of our many experts, thanks so much for coming in.
Thank you so much.
He's going to be there taking our calls next door. The number to call is 410-481-2222. Jamie?